Alright, I'm recording now.
Here are my note cards. One more scan. You guys ready?
Hi, class. It's amazing you can do class over the internet like that now.
Alright. So, 6 months ago, my husband and I had to put down our 8-year-old Great Dane Bruno due to a neurologic disease called Wobbler Syndrome. This disease affects the neck and the spinal cord of large breed dogs. I'm here today to inform you about the 4 symptoms of Wobbler Syndrome. I'm going to hand out the different types of breeds that are affected by this disease. It is a large breed dog disease that affects mainly all large breeds. However, it can affect some small breeds. According to the Veterinary Medical Database, the highest percentage risk dogs affected is 5.5% of Doberman Pinschers, as well as 4.7% of Great Danes. Other breeds that can be affected are Rottweilers, German Shepherds, and Weimaraner's. There is no known cause for Wobbler syndrome. However, many believe it is due to genetics. Dr. Ronaldo da Costa, DVM of Neurology at Ohio State University, is investigating a study on the genetics on Doberman Pinschers and plans to study it in Great Danes as well in the future. The symptoms of the disease can include a wobbly gait or walk, lowering of the head as they're walking, which can indicate a discomfort or pain in the neck region of the animal. Some more advanced symptoms can include weakness in the legs or difficulty getting up. And the most severe symptom can be acute paralysis of all 4 legs. The Ohio State Department of Veterinary Clinical Studies showed 5% of dogs affected with Wobbler syndrome can be affected with the acute paralyzation. Since there is no known cause for Wobbler syndrome, what then actually causes the symptoms of this disease? The handout that I have is showing what the cause and how it affects the spinal cord of the disease of the dog. Wobbler syndrome is caused by a compression of the cervical spinal cord and a narrowing of the spinal canal. In Dobermans and in Great Danes, this skeletal abnormality occurs mainly in the last 3 cervical vertebrae. There are treatments for this disease, and the 2 treatments are medical and surgical. The medical treatment includes using anti-inflammatories and restricted activity. The surgical approach has several factors to consider when you want to do a surgical procedure. These factors can include the severity of the symptoms, the severity of the spinal lesions that have been found, and any concurrent medical conditions that the dog may have. There are at least 21 known surgical procedures for this type of disease. Ohio State University showed that a study done on 104 dogs had a success rate of 50% of the dogs improving medically and 80% success rate in dogs with surgical approach. The last handout I handed out is just some post-surgery pictures of a Great Dane and a Doberman Pinscher after they've had their surgery. Basically, they are not allowed to have any neck harnesses or anything on them afterwards. They still pretty much have to have some restricted activity to have them rest up. But the success rates are pretty high that they can live a normal life afterwards. However, when we had Bruno, we caught subtle symptoms until it was too late. So unfortunately, we had him he was completely paralyzed by the time we caught what the disease was. Because he was not a dog that showed a pain or showed that he was in any type of distress. So what did we learn today? Wobbler syndrome is a neurologic disease that affects large breed dogs and affects their quality of life when not caught in time. It has subtle symptoms that, if going unnoticed, can make a turn for the worse. I hope this speech has made you more aware and provided some useful information. Thank you very much, and I appreciate it.
Thank you. That was very informative.
Yes. And I don't remember if I'm supposed to record that part or not, but I'll record it on there. So. But I do have, like I said, small thing.
Hey Bruno,
Yeah, Bruno.
did we ever notice something?
We probably wouldn't have known it with Bruno. He didn't show any signs of it. That dog was the happiest thing ever. All he ever wanted to do was just, he was just a big love bug, you know?
Yeah.
And it happened on a Friday. I noticed that he was walking a little funny or a little drunk. And
Close the door.
Saturday,
Close the door.
Saturday he had lost use of one of his back legs. But again, he wasn't showing like really any pain. When I pushed on his spine, he seemed a little aggravated, but with help he was able to get up. And then by Sunday, he had no use of all of his legs. That's how quick.
Shut the door.
Oh.
Yeah.
But even that, he couldn't move he was still.
Yeah, he still even tried to move. I mean, he tried with all his might to get himself to move.
His brain.
It was,
Yeah, mentally he was still there. He just physically just couldn't move.
yeah, it was really sad.
Yeah, I keep an eye on my daughter's new Great Dane.
Yeah, like I said, it's 4.7% in Great Danes and 5.5% of Doberman Pinschers. Those are the
They just got
two
him and he
breeds.
already, is having problems, so I just wanted.
Yeah, large breed dogs have so many problems, but that is just one that it's higher up there than you ever realize.
Yeah.
I mean, I didn't realize how high it was
I
up
let
there.
them keep an eye on.
Yeah.
Yeah.
So if it's heredity for the dogs to have it, what happens is it compresses. What is it that makes it compress? I wonder.
It's their skeletal as they're growing up. They grow up so fast that their bones and their muscles, I guess, just can't keep up, and I guess it just compresses. It's just from what I read, it just seems like that's, I guess, from them developing so quick that it's just a skeletal abnormality that these dogs have for some reason.
Humans get that too.
Yeah.
Because my cousin's my sister, she outgrew her. They had to put a rod in her because she outgrew her skeleton, basically, the back. And they had to put it back, and they had to do the thing in the stuff. They had to put a skeleton.
This for support.
The cast was from chin to her toe. Full body.
Wow.
Wow. So I mean,
Wow.
Yeah, they don't full body cast them. They're usually just effects right there. So they have, I mean, you can only imagine them trying to have to deal with.
with the water.
Did Alan tell you how they misdiagnosed him?
Yeah, you had something with your cervical.
I mean, Micah. They
Oh,
misdiagnosed him.
Oh, really?
He's got that collapsed trachea
Right.
and not heart disease.
He doesn't have the card.
And it's been taking that Lasix and it threw off his electrolytes. I mean, it could have killed him. All that heart medicine.
Well, when I had my neck problem, I'm not comparing my nothing at all, but it was the compression, and then when they had to go and cut vertebrae away from the spine.
That's probably the way they perform
And
that.
then, you know, and it might just happen.
They do that to take the
overnight.
pressure off the nerves.
Yeah, just, that's the thing, just one, yeah, overnight.
Like within 5 days, 4 days, I lost the whole use of my right arm.
Yeah, I mean, with this thing, it seems, from what I've been reading, it seems like it's just a very gradual thing.
And it's
Unless,
something that triggers it, makes it happen.
yeah, I mean, I guess it can happen.
Well, it just gets to the point in where it just, everything stops working.
Yeah. That's scary.
Yeah, it's
Yeah.
crazy.
Yeah, it is.
It is.
All right, I'm stopping recording now.
Done that